In this patient, we have a echogenic mass shown here, a cystic mass, and a lesion with some thin fibrin strands. So this patient has a large dermoid, a smooth-walled cyst, and a hemorrhagic lesion. And when we do color, we can see that these lesions, these interfaces, in fact, have little or no vascularity. Here we have a lesion that has no internal vascularity, and we can see that this is a uniformly echogenic lesion. Endometriomas may have the so-called ground glass appearance, as we can see in this image, of clotted blood. Tubo-ovarian complex, the tube has endosalpingeal folds, as we can see here, as little projections into what is a distended tube. Endometriomas can have echogenic foci, as one can see here, and these are areas of hemosiderin and cholesterol deposits due to breakdown products. And here is the Doppler of that lesion. Sometimes there can be some increased flow around it due to fibrosis. This is a hemorrhagic lesion that has undergone torsion, and there in fact is no blood flow to this torsed ovary. This is an appearance of a dermoid cyst with an echogenic area related to sebum and some vascularity surrounding it. And here is the blood flow. This is a ruptured cyst with a surrounding solid hematoma. This is kind of homogeneous, and this pattern, of course, is nonspecific, but is typical of a resolving hematoma. This is a lesion that has multiple locules within it, and as you can see, areas of increased blood flow in the center of the lesion. And on 3D color Doppler, you can actually see the vessels and their surrounding normal tissue and the small locules of pus. And we'll see this on the 3D video, which I'll show you later in this talk, showing the increased vascularity inside this tubo-ovarian abscess. Solid lesions are typically fibroids or metastatic lesions to the ovary, or in some cases teratomas. This is a picture of a adenocarcinoma of the ovary that's a solid lesion. This is a color Doppler showing an area that is solid arising from the left ovary in this patient with colon cancer, which was a metastatic tumor with very low impedance blood flow. And this is the right ovary in the same patient with bilateral ovarian metastases. This is a patient that has a solid lesion with some cystic spaces, and this is a germ cell tumor. Most ovarian cancers are of epithelial origin. Only a few percent are related to germ cells, and this is an example of this. A very complex solid tumor with low impedance type flow. Now one can quantitate the vascular index, and as you can see from these graphs, our experience is that malignancies have greater vascularity, but there is some statistical overlap. So the sonographic differential diagnosis depends on its location, consistency, and vascularity, and you really need to know the clinical setting to give the best differential diagnosis. You can improve your specificity by using color Doppler, and I will show you some examples of that. This is the result of a large study in Europe where they came up with so-called rules for diagnosing ovarian cancer. Basically, cysts that are unilocular with little or no solid components and no blood flow are typically benign, whereas malignancies were irregular, had ascites, papillary excrescences, and irregular multilocular lesions with high color content. And with this differential, they could have a 90+% sensitivity and specificity. 3D color Doppler, or 3D in general, is very, very helpful in gynecology. It allows us to see better the pelvic mass as well as uterine disorders and the vascularity. As you can see, some probes are simple mechanical sectors that scan through an area of interest and build up a 3D image from multiplanar reconstruction. And this is an example of multiplanar reconstruction of this cystic lesion, as you can see here in the long axis, in the orthogonal plane, and in the coronal axis, and in the sample volume, that this is a simple cyst with thin walls. This is a lesion that has very thin fibrin strands, as we can see, as a sign of benignancy. This lesion, on the other hand, has more solid and irregular areas, but had no blood flow in the center of this and is typical of a hemorrhagic cyst. This is a very nice image of a 3D depiction of papillary excrescences within an ovarian cancer. Now, there is a new probe that is a so-called live 3D or matrix array probe. It consists of multiple elements and allows live 3D. I'll show you an example of a pelvic mass. This is just the typical image of the liver with a matrix array probe. You can see the scan plane is selectable. The sample volume is continually updated so that one can image in any particular plane. Here we're going down into different levels in the liver. This is an image sent to me by Dr. Wen Chen from Peking, and this is a ovarian mucinous tumor. And as you can see here in 3D, we've color-coded the sepia or orange is closer, the blue is further away. And we can see beautifully the internal septations in this ovarian tumor using this 4D technology. Now I'd like to show you how 3D color Doppler can be applied. It allows us better determination of location, organ of origin, allows us to serially evaluate fibroids, uterine malformations, and tubal disorders. And this can be obtained by using a freehand, which is not used that much anymore, but with automated scanning, the volume that is rendered can be evaluated by looking in different scan planes. And this is an example of an ovarian cancer. In this plane, we can see the tumor here. In this combined grayscale and 3D color Doppler, we can see abnormal vessels in the area of the tumor. We can see in this plane the internal vessels that are shown very nicely on this image.